And in 1958, 60, 62, George Kelly, who I regard as one of the founding fathers of cognitive behavioral therapy, came up with a theory called personal construct psychology, otherwise known as PCP. And we're going to get back to pain management sometime today. So George Kelly came up with PCP, or personal construct psychology. And he, according to George Kelly's belief and theory, everybody has a pair of dichotomous constructs in their mind. Not black and white or right and wrong. They are dichotomous constructs, but they're semantic. So if you asked George Kelly what would be the opposite of happy, he wouldn't say unhappy. That's semantics. The opposite of happy would be lonely. Is it? I don't know. It depends upon the person. And that's where personal construct psychology can help redefine a person as a whole person psychologically. And I'll give you an example. So suppose a person comes in and says, I'm in chronic pain, I have hip pain, they said I'm not a candidate for hip surgery, but I really love my garden. I lay on the ground on a piece of cardboard, I pull myself around the garden, and then I pull myself up to this tree, and I lift myself up to the tree, and I look out on the garden, and she says to herself, you wanted to put me down, but I conquered you. So I said to her one day, what's the opposite of pain? And she said, the conqueror. Now, that makes sense, but it sounds so easy. The personal polar opposite, the PPO, the personal polar opposite of pain to her is the conqueror. Now you've given me something to work with. Now I could ask her, how old were you when you first discovered the conqueror? Where did you first find the conqueror? Was it at Sunday school? Was it at the school bus? Was it in the schoolyard? Was it during a math test? Was it during cheerleading? Where did you first discover the conqueror? Where do you go to refresh the conqueror? How does the conqueror get refreshed? What makes the conqueror strong? What groups do you belong to? And if I were to say to her, well, now that you're talking to me about the conqueror, a scale of 1 to 10, where would you be as the conqueror? And she said, oh, I'm a 9. So she came into my room as an 8 or 9 in chronic pain, but she left my room as a 9 in conquering. And that's what George Kelly was talking about. The ability to redefine a person's psychology. Not to come in as a person of pain and leave as a person of pain, but to come in as a person of pain and leave in with the dichotomous pair that they already have in their mind.